You hear me okay?
Yes, sir.
All good?
All
Okay,
good.
thank you. Um, Welcome, students. Appreciate your joining us for this chat on Introduction to Public Health. This will be the last time that I'm with you on this interaction. And I hope that you've had a good semester. I know you'll be getting ready for your final quiz on Wednesday, and then your course is concluded. So I hope that that you're pleased with that and looking forward to that. I wanted to do just a couple things today. The first was to take a few minutes and just review and emphasize a couple of points in the textbook chapter 14 related to public health systems and systems thinking, related to the lecture which I posted yesterday, which will be the subject of the quiz on Wednesday. Then I want to take a few minutes to tell you a little bit about our College of Public Health, and then I'd be pleased to hear any comments or suggestions from any of you regarding the course, how we can improve it, things we did well, things you'd like to see more of. I'm really open to that and be happy to listen to that. And of course, you can also make any comments you want through the usual course evaluation process, and we take those into strong consideration and look at those and take them very seriously as we review over the summer and prepare for improving the course each time we offer it. I do want to say I know that this has been a particularly challenging semester since the spring break, with the steps that the university had to take regarding the mitigation of the COVID-19 pandemic and its impact on Oklahoma and on our university. I know all of you have been impacted by that very significantly. I don't underestimate how important and significant that was in changing their day-to-day life. And I want to congratulate all of you for sticking with it and for your dedication and commitment, dealing with a very challenging and sometimes perhaps stressful situation. We do appreciate you. We know how hard you work and your goals, and want to make sure that we can continue to work with you to help you meet your educational goals. So let's start by talking a little bit about the topic of public health systems thinking and systems that I posted up in the lecture yesterday. So these were the objectives that are listed. I'm not going to go through the whole thing again. It's in the recorded lecture. I just want to highlight a couple key points. I want to emphasize the distinction between traditional reductionist thinking, which has been what has mostly been used in science and public health. That is looking at one factor or variable at a time, the relationship between tobacco and health, the relationship between obesity and health, the relationship between health insurance and health outcomes, and so on. And emphasize that systems thinking is really designed to look at the impact of multiple factors and how they work together as parts of a system. The system may be a biologic or a pathophysiologic system, like the human body, or it may be an organ system within the human body, such as the cardiovascular system or the renal system or the endocrine system. Or a system may apply to an organization, like a health department or a network of health departments, or the public health system writ large, that integrates a variety of different state, local, and federal agencies and other things. So system can be applied broadly, but there's increasing influence and importance of bringing systems thinking to how public health works and should work. Okay, so this was the definition of a system. Systems analysis That's reviewed in the lecture in detail. And I want to just look at the topic here of coronary artery disease, if we want to use that as an example of a system from the perspective of pathophysiology in a condition which contributes, many, many deaths and morbidity to our population every year. Coronary artery disease really refers to the narrowing and the buildup of plaque and narrowing inside the arteries that supply the heart. And this is the underlying driving cause of heart attacks and of heart failure, ultimately, after many heart attacks. So when we think about the steps of systems analysis in the lecture and in this table, it outlines steps 1 through 4 and then illustrated each of these actions with respect to the condition of coronary artery disease. This is an example of applying systems thinking to a pathophysiologic system or condition. So factors that influence coronary artery disease one at a time: cholesterol, cigarette smoking, obesity, high blood pressure, etc. Those increase occurrence. But a systems thinking approach wants to understand how they work together. And then what is the strength of these different influences? Cigarette smoking, very powerful in promoting a decline in health and a coronary artery disease. Cholesterol, also very powerful, obesity, and so on. And they have relative risks or odds ratios of between 2 and 4 as an idea of when they're strong. And then interaction, this step here, number 3, is there interaction between these factors? This is where system thinking goes beyond individual risk factors, okay? And the metabolic syndrome, which is an example of conditions where 2 or 3 things come together: high blood pressure, cholesterol, high cholesterol, and high blood glucose, okay? Not yet to the point of being full diabetes, but this is metabolic syndrome, okay? And then sometimes there's feedback loops. So for example, weight loss can be very powerful in helping many of these individual areas or risk factors, such as high blood pressure, such as high blood sugar and cholesterol. If you do significant weight loss, you will see each of those parameters improve, okay? But applying a broader approach to either a biologic or pathophysiologic condition or to an organization or to a problem, this is what we mean by applying systems analysis and systems thinking. Okay, so there's more steps. Now we can apply systems thinking to a public health problem also. So the book uses the example of motor vehicle crashes, and this is a great area where we've had tremendous success over the last 50 years to really reduce the rates of death from motor vehicle collisions. Still, motor vehicle crashes are the #1 leading cause of death for individuals between 15 and 40 in our population. But the organization, the National Highway Traffic Safety Administration, or NHTSA, sometimes abbreviated as NHTSA, has been very rigorous in applying a systems thinking. And if there are people here who have any courses in engineering or engineering background, then they understand how that's applied. And here they were looking at 2 variables on the rate of motor vehicle collision: texting, speeding. And when you draw these kind of diagrams, you show when it has a positive influence here, for example, to increase collisions by texting, we show a plus sign. These are examples that have positive effects on collisions and on having a driver having a slow response, which also has a very positive effect on collision, i.e. slow to hit the brakes, runs into the back end of someone. Speeding, following too close, not leaving enough distance, very significant in leading to an inability to respond in time and a collision. Texting, very distracting, like more distracting and has a bigger effect on response and driver appropriate response than blood alcohol level of 0.08, for example. So this is how we begin to analyze these factors, and then that can become more complicated, as shown here, where we look at a variety of different influences, positive or negative, on collisions, injuries, and then death and disability, okay? And these diagrams can be broadened out in even more detail, but here you see alcohol use influencing motor vehicle collisions. It influences whether a person speeds. These bigger arrows, thicker arrows, indicate a more strong influence. Plus means increases collisions. Negative, the minus sign means it would decrease. Okay, improvement in road safety technology will decrease collisions. Road safety technology means the nature of signs, how they are illuminated, what they look like, how simple they are for drivers to follow them, details about cutoff ramps, barriers, all kind of things to prevent serious collisions. Vehicle collision prevention technology, very significant. Backup cameras, sensors, all those things have an effect to decrease, but notice the thickness of the line is nowhere near as thick as for speeding and alcohol to promote collisions, okay? So not only do we look at a direction of influence, increasing collision or decreasing collision, but the thickness of these lines determines the magnitude of that influence. And we can go on and talk about what vehicles have done to improve their safety, passenger restraints like airbags, emergency system, and so forth, okay? And this is just an example of how you can apply systems thinking. Now, you could put a different problem here. You could put obesity in the middle and do all of this around it and look at the factors that influence obesity positively or negatively. What else did I want to just underscore? Here we talk about when two or more diseases occur together, they may interact to modify the occurrence and the burden of that disease. And so good examples of these are some diseases predisposed to others. For example, if we look now at COVID-19, the viral infection with COVID-19 predisposes to subsequent bacterial infections or predisposes to blood clotting problems or strokes in young adults, which has been a recently reported important phenomenon. We can think about other conditions. HIV, TB, malaria tend to go together. As I mentioned, obesity, hypertension, high cholesterol, diabetes, etc. And then alcohol and motor vehicle crashes, alcohol and domestic violence, alcohol and liver disease. Alcohol is associated with multiple different conditions, okay? Sometimes these conditions can interact and magnify the problem beyond just one alone. Okay. Now, the last thing just to re-emphasize is this idea of health in all policies, which really is the concept that whatever we do, whether that's a policy on business, a policy on transportation or housing, or numerous other areas, that these policies often have consequences for population health. And the more that we can think about that and be attuned to that before we do them and understand that every policy, and so for example, the policy we've just been through, which is shelter at home to bring down get control of the COVID pandemic and its growth of infected cases in the state, no question has other health implications. For example, for patients being able to use the hospital who have coronary heart disease and need surgery, for people who need hip or knee replacement because they have worn out hip or knee and they're suffering with those conditions, and on and on. We can go on and look at the other consequences. That's the case of a health policy influencing those things, but other policy influences health. For example, if you are allowed to buy liquor or beer in a grocery store or in a store like a food place or a 7-Eleven or so on, what does that do to access to alcohol? What does that do to the issue of alcohol and impaired driving? And does this policy of these expanded access, or does the policy on drinking age influence, for example, the health outcomes of people who decide to use alcohol? How we design our roads, where we put do we have sidewalks? Do we have a capability for people to have interaction, to walk within a city? All of these issues have important consequences. Landlord-tenant law has very important consequences on health and all policies, especially for individuals of lower income. And here then finally the example is the food safety and the supply chain, because many companies are using similar supply chain pathways. The breakdown in one area can influence a broad spectrum shortage or problem in our food chain, for example, related to foodborne illness. Many suppliers are using the same supply chain and sourcing for their lettuce and other things in prepackaged salad material and so on. And if that gets contaminated, its effect across the country can be profound. Okay, and so we want to be sure that when we do policies regarding suppliers and business and other things, that we're sensitive to these issues. We are very sensitive now to the issue of COVID in China has led to shutdown of some of the companies that produce generic medications. And so some people, medications unrelated to COVID, where we're having a trouble getting them because the production has been shut down due to COVID, for example. And we can go on and on and on. But as you go forward as health professionals or individuals in this field, please educate people that every policy we write has some impact on health. There's no question about that. Okay? So that's what I wanted to show on that. I'd be happy to take any chat questions that you may have. Okay. The second thing I wanted to do today was to tell you, as we come to the end of the semester in the Intro to Public Health class, again, I hope that all of you have had a reinvigoration or a stimulus, or that your interests in public health have been met, that your goals for taking the course and your enthusiasm for public health is increased, not dampened by our experience of having to shelter with COVID. But I want to share with you a little bit of background about our College of Public Health and the graduate programs we have and opportunities there for ongoing education. So our college was founded in 1967. It was one of the oldest independent accredited colleges of public health. We were founded in 67. We became accredited in 1969. We have right now approximately just under 150 students, maybe more closer to 130, 135, between 40 and 50 full-time faculty with 21 different degree programs, master's and doctorate. And our emphasis is on training public health professionals who may either go into public health practice at state or local government agencies, or, for example, who may become researchers and who may translate their science into public health practice. So we have two types of degree programs. And we have professional degrees, the graduate level, or graduate degrees. Professional degree, the distinction are that those degrees are coordinated, administered, and awarded entirely by our college, the Hudson College of Public Health. Graduate degrees are overseen, administered, and regulated by the graduate college, but the degree options, the curriculum, and the execution of the degree is at the department level within different colleges and university. We have multiple Master of Public Health degree programs. That's the bread and butter program for public health professionals. We have certificate in public health for graduate courses that can be attached to any other degree program. We have a Master of Health certificate in healthcare administration for individuals going through the MBA program who want to get a little bit of background in health. Our Master of Health Administration is a very rigorous master's degree, 60 credit hours as a master's degree, really to train senior level hospital administrators or other senior level health administration executives. And we've been very successful at doing that. The Doctor of Public Health is being suspended due to the lack of interest mainly. So those are our core degrees there. We have rigorous PhD programs and really sought after individuals. So on the order of 25 to 30 PhD students in the college spread across 4 programs: epidemiology, biostatistics, environmental health, and health promotion. We have a number of Masters of Sciences. So I'll show you here a list of the different degrees that we currently offer. All the individual ones are here, and then the joint degrees are shown here, either with the MPH or with the MSW, MPH with the JD, MPH with the MD, or MHA with the JD, which is quite a challenging and a rigorous program. And then there's the interdisciplinary public health degree for individuals who are coming into these programs without much, if any, exposure to public health. If you are a student in the 3 undergraduate options, either the Bachelor of Public Health and Community Health or the BS in Public Health and Community Health or the BPH, then if you come into one of our graduate programs, I would encourage you to go to a specialty degree such as epidemiology or biostatistics or health promotion or health administration and policy. We do our teaching linked to competencies that are defined between us and the regulators, the Council on Education for Public Health, so that we know that all graduates will have knowledge, skills, and abilities that are central to being a public health professional. We have a certification exam in our profession, just like the medical students have it, the STEP certification exam, Step 1 and Step 2, or like pharmacy does, or nursing or dentistry. This is a characteristic of health professions in general, that they're, after your degree completion, you also have a certification process. Remember, certification is a process done at the individual level to assure competency among individuals with specified degree credentials. Accreditation is a process done at the organizational level to ensure that these organizations are delivering excuse me, the highest standard of education or patient care. So educationally, we accredit the college by this organization, CEPH. We have to go through peer review to do that. We accredit health departments, as you've learned, through Public Health Accreditation Board, the FAB, and we accredit hospitals through the Joint Commission to make sure that they're meeting certain standards. Okay, so again, remembering that certification is at the individual level, accreditation at the organizational level. This is the certification examination for individuals who are eligible, having completed 21 hours within their MPH. And we require our students to take this and to get this as a certification upon their MPH. And this is very valuable. It's a good thing to have on resumes, and increasingly employers are looking at this very significantly. So with that, I'm going to stop and then see if there are any questions or discussion people want to bring. And if you want to talk, you can just go, if you'd rather talk rather than, email back and forth, just type raise your hand in the Zoom chat box and we will unmute you and, engage in conversation. Or you can type your question in the chat. It's a very quiet group, not too many students today. I know this is the last week and everybody's busy getting ready for exams and so on, and it's been unusual this year as well. So if you think of some there, go ahead. Let me also open up then and ask suggestions from the students, please. Any suggestions? How do we make things better? How do we improve? What did you like about this course? What didn't you like? What should we work on to strengthen and improve this course? What would you like to see more of in your learning about public health? Quiet crowd. Well, you will have the chance to do that more formally in the course evaluations. And please speak up. We need your comments, your input in order to help us improve. And also put in what specifically might have been challenging for you as a result of the COVID-19 actions, because we need to understand that so we can fix those, because this virus is likely to be with us for at least another year to 18 months in a significant way till we can get our vaccines up. Okay, Gracie, thank you. I really appreciate that comment about how it's laid out clearly, and I think I've seen even some areas that I can improve on that and do that as we go forward for the next cohort coming through. Haley, a public health major aligns very well with pre-med. We structured the major so that it doesn't impair your ability to complete any of the required pre-med prerequisites. So I think you should speak to your advisor, look at the degree sheet for a public health major, look at what the pre-medicine requirements are, and then you should be absolutely very able to complete your pre-med prerequisites as well as doing the public health major. With, generally much of the pre-medicine prerequisites happen in the first 2 years, maybe a little bit in the third, whereas you can do most of your public health majors prerequisite required courses is in the third and fourth year. It doesn't have to be that way. You can push it forward, but I don't think there's a lot of room in the first 2 years. Although I do like that some students can get the intro course early so that they can get an understanding and see whether this is something they like. But very good alignment here, and the advisors can help you to make sure that you meet both of those, because having a major in public health is a great preparation for medicine, given the way healthcare will move in the future. We talked about this. There'll be an increasing emphasis on social determinants of health and healthcare delivery, and an increasing emphasis on population health. And having physicians who already have background in public health will be really, really important for our country. Mariah, thank you. Yes, I've had that comment before. Include more class interaction during the lectures, and I freely admit that, again, I'm struggling to figure how to do that given the size of the class. But the good thing is that as we go forward in the fall, class sizes will not be, I don't think, will be allowed to be like 60, 80 people due to social distancing for COVID. So I have a lot of ideas that I've been discussing with the provost on the Norman campus and the dean of arts and sciences as to how we achieve exactly what you mentioned. And so thank you so much. And this will infuse into other courses in the major. So hopefully you will see that if you're a major, public health major, as you go forward in some of the other classes, you should see that as well. More interaction is what we want to do. And I've certainly learned a lot through this, this time about using the technology for things where we can pre-record things and put them up for you, and then use our time together like this to have more interactive discussion. Gracie, thank you about the quiz format. Excellent. We don't want you to be drinking out of a fire hose. I sometimes, in my enthusiasm to teach you as much as I can, I actually include too much. So I think we found a little bit of a balance based on your comment. And the readings are there, but that was a little bit ambitious on my part. I'll probably organize that a little bit differently and integrate them better. But that's a very helpful comment for us to consider. Thank you all so much. I appreciate you making these comments. If there are any others, I'm happy to listen, hear them. Okay, well, again, thank you. I want to wish you all good luck. I hope to see some of you or all of you in future courses. Be safe, pay attention. This COVID virus is serious and one that should be taken very seriously. So please comply with all the recommendations about social distancing, about protecting yourself and so on. And I hope to be able to see some of you back in a little more new normal environment. I think that's the way to think about it. It will be a new normal. But again, back to see some of you in the fall semester. So I wish you very good luck. Good luck on the final quiz and have a great summer. And I've enjoyed teaching all of you. Thank you very much.